So here are the 6 facts I want to mention in this particular video. 6 facts about blood test. Number 1 fact is this: blood tests are quite useful in making a diagnosis. Actually, very useful in confirming a diagnosis. So blood tests are useful for making diagnosis or confirming a diagnosis. Fact 2 is that blood tests are useful before initiating a treatment. For example, patients that are to be started on TB drugs, they are required to do liver function test to check for the enzyme levels of the liver before commencing the medications, because some of the medications will affect the liver. Also, kidney function test is done. The 3rd fact is that blood tests are useful in determining if complications have taken place. For example, a patient that has hepatitis B, one of the things that is done is to have a regular liver function test done. So to check if conditions are setting, patients may present with yellowness of the eyes, and then doctor examines, feels the liver may be enlarged. So a complication in that situation could be a liver cancer. Such patients can have their liver enzymes checked using a blood test, and the liver enzymes will be markedly elevated. So the 4th point is that they are useful. That's the 4th fact, is that blood tests are useful in making a prognosis. Prognosis in the sense that to determine whether an individual is going to come down or die from a particular condition. For example, in patients that have cancer-related conditions, there are some blood tests that could be carried out to determine the possibility, the survival rate, or the level of affectation of the condition in the individual. That's the 4th fact. So that was the 4th fact. Stay tuned. I'll be right back. Okay, you're welcome once again. As I was talking about facts about blood test, I've mentioned 4 facts. The 5th fact is this: blood tests are important in determining progress. What I mean by that is in determining the response of an individual or a patient to the treatment that's being offered. For example, in patients that are diabetic, such patients have been placed on oral hypoglycemic agents, drugs for diabetes, and regularly their blood sugar is checked to see whether it is well controlled. For such a patient can be asked to do a fasting blood sugar, a 2 hours postprandial, or even glycosylated hemoglobin. That's to check long-term control of blood sugar in a diabetic patient. This is very important to know how we are winning over that particular diagnosis or disease condition. And lastly, the 6th fact is that for a blood test, it is useful in determining whether treatment has been achieved. If an individual has been cured of the medical condition for which they were commenced on treatment. For example, in patients who have had a malaria diagnosis, remember earlier in the video I talked about the information that an individual supplies to their doctor, that is the history, all the questions, all the complaints, and then the examination to check for signs, possibilities of some signals that this is a particular condition that we may be dealing with. And then the blood test is done. Malaria parasite rapid diagnostic test may be done, microscopy may be done, and then the patient, if positive, if parasites are found, then commenced on medications. But to find out if such a patient has been cured of or has achieved clearance of the parasite from their blood, then a blood test could be done. Usually, it's expected to be done to confirm the cure from that malaria infection. So, those are the 6 facts when it comes to blood test. That's just some of the facts. Why blood tests are important. We just talk about the facts, but I want to let you know why blood tests may be useful for you when you visit with your doctor.